I hope you have managed to go through all the floors. I know a lot of people on the stores probably haven't, but the audience have been enjoying. The sun is on our side as well. We pulled a lot of strings for that, so you can thank us later for that one. My name is Sharan Kaur. I have been working alongside Peepul Centre and a massive supporter of the Peepul Centre and everything that's happening here. So I'm just delighted to welcome you all to the Peepul Mela today. It has taken months of hard work, but I think they all deserve a round of applause. I'm sure the world first. Peepul Mela. I like that one first. Oh, I need to be louder. Wow, that's never been said to me before. That's very close to my face, still being intimidated. I don't think I need a man. So, this particular area we're in now, we're looking at our health, which is a massive importance for us all, especially with COVID and everything that's been going on. So I'm going to introduce this amazing lady. I am a bit biased. I am like fangirling her. She is very talented, and it's Dr. Santosh Bhanot. Her passion and interest working with vulnerable adults and children in health-related areas, not only in the UK, but also in India in partnership with charities. It's amazing. She's a trustee of our parent charity Ethnic Inclusion Foundation and also the head of People Health, a group set up in 2021. Last year, in partnership with the NHS, she started the People Crisis Café. This supports the Belgrave South Asian community looking at alternative mental health concerns, which is a massive thing, I think, for our community. Santosh is the chair of the charity and Ealing Music Therapy, which works with special needs schools with children and special educational needs. As a founder and chair of the Asian Circle, she helps women and girls suffering from domestic abuse in India and in UK. Santosh works as a senior scientist and at Procter & Gamble, spending over 20 years in healthcare. It is safe to say she's a walking amazing lady. She is very talented, and I'm going to give the mic to her. So can you do a massive round of applause, please?
Thank you, Sharon. I mean, what can I say? I hope I live up to your expectations.
You do.
So as Sharon said, this actually brings us to the sort of slightly more formal, but yet still informal part of the Peepul Mela, which has been going on for the last 2 days. Yesterday we had an amazing cultural evening, and today we have, as you've seen, things going on the 3 floors. And really what I want to say is, on behalf of the Ethnic Inclusion Foundation and the Peepul Centre, a very warm welcome to our Peepul Mela today. It's been a great busy morning, and I hope you have had the opportunity to experience some of the delights. Our vision at the Peepul Centre is to build a community arts, culture and wellbeing hub. This part of the Mela, as Sharon mentioned, is focusing on community health and wellbeing, which we are extremely proud to be hosting in partnership with the NHS, our community partners, and there are a big number here today, so thank you, and also the independent healthcare companies, which I think is also important to bring on. I'd like to, before I continue, introduce Aysha Jagat. She is the NHS City East Mental Health Neighbourhood Lead, and I'd just like you to come and say a few words, please, Aysha.
Woo!
Thank you, Santosh, and it's great to be here today. I just want to say welcome and thank you for coming along to this amazing event, because I think it's a great way to network with each other and also showcase some of the excellent work that's happening within the communities around mental health and well-being. So please do take your time out to go and meet everybody and connect with everybody. Hopefully we'll have a session later on today as a presentation as well. So I'll speak to you in a few minutes. So, thank you.
Thank you. Health is an absolute must for thriving communities. I'm sure you'll all agree. At the Peepul Centre, We have ongoing active programs on heart health, diabetes and nutrition through our residents. Our vision at People Health is to amplify these in a cohesive way, working in partnerships with the NHS, community and the independent health organisations I mentioned. In 2021, the People Centre launched the People Health Department, looking to build awareness and help address prevalent health issues amongst the South Asian communities of Belgrade and Leicester. COVID, as you all know, became rampant. The People Centre quickly got into gear, prepared and distributed over 5,000 free meals in the first month, which in the year amounted to 100,000 meals, something that was extraordinary, but I have to say came about because of the number of volunteers that put their hands up and said, we will come and help. We will come and help the community, we will come and help Leicester. So these distributions were to the vulnerable, nurses and key workers. And later, as I think some of you may know, the People Centre proudly became a much needed COVID vaccination hub. Can I have slide one please, Sharon? Mental Health Week starts tomorrow, and mental health is an area we are particularly interested in. Behind the devastating and disproportionate effects of COVID-19 on the minority communities, Ethnic Inclusion Foundation, the commercial parent of People Centre, based in London, commissioned a report with CARE, a mental health academic group, on understanding and improving mental health of South Asian populations. Copies of that report are available on our People Crisis Café if you want to actually dig into that a bit more. It makes good reading and very, very interesting reading, and it goes all the way back to the anthropology and the migration of South Asian communities to the UK. The report highlights that South Asians living in the UK face a unique set of mental health challenges related to biological, psychological, social and cultural risks during their lifetime. Notably, mental health issues are very much on the rise. Often these are complicated by other health and social inadequacies such as poor housing, overcrowding and unemployment. Can we just have the next slide, please? The picture today is that there is an enormous amount of work being undertaken at grassroots level to help mental health. But, and this is the important thing, it's not often utilised in interventions. And as such, the voice of the service user does not translate into the planning of mental health programs and therefore solutions. More needs to be done in engaging not only these communities but also commissioners of mental health services and of course the policymakers. We suggest that the way forward includes primary and secondary care services working with the public mental health to ensure that mental health needs of the South Asian communities are met in a culturally appropriate and a culturally sensitive manner. Next slide, please. So, Helping Hand slide. This is really the conclusion of the report. And in terms of recommendations and next steps, a comprehensive roadmap is outlined in the report. And this Helping Hand approach is to improve outcomes for South Asian mental health service users. Very briefly, I'll walk you through it. Firstly, and we're talking on your left, identifying unmet needs around current services amongst the South Asian communities. And this is something that in fact the NHS in Leicester has been actively doing, I'm proud to say, over the last 2 years. Some of you may have taken part in research and focus groups when they were collecting data on mental health issues. The second digit, co-development of mental health services. This is really with input from the ethnic minority group service users, where we can then develop a service that meets both the needs of the South Asian communities as well as inputting into the existing clinical interventions. Anti-stigma campaigns. Stigma is one of the largest barriers why help is not sought among South Asians. And as you know, certainly in Hindi there is one word which we refer to when we talk about mental health, and it's pagal, which is hugely derogatory, and you would never actually have that term referred to any immediate relative of yours. So we do need this anti-stigma campaign to get out there and realise that everybody has a bad day, a blue day, and 1 in 4 people will suffer mental health issues. We then need effective intervention evaluations, in other words, what is working. And then importantly, and I think this is probably one of the biggest pieces to stress, we need culturally aware workforces working in the NHS and at the interface where South Asians are going in and wanting help. This means that care can be provided for cultural, religious and spiritual needs, historical and gendered influences. At Ethnic Inclusion, we want to use this helping hand roadmap to scope out next steps. Our new initiative, which we are so pleased about, the Peepul Crisis Café, and our stand is over there, in partnership with the NHS, begins to help co-develop mental health services within the community. This is a free, safe drop-in service for anyone experiencing mental health concerns, for confidential conversations and signposting on for help and support, and importantly, recovery plans. You'll hear more about this from Louise or Aysha later on, and the work that Leicestershire NHS is doing on this. So I'm going to move on to my last slide, and it's a video. Mental health, as you know, is prevalent, and the more we talk about it with someone we trust, the easier it becomes. And we've actually seen that with the people that are using our Crisis Café. Arts is one of the interventions that can enable difficult conversation. And this musical film I'm about to share was commissioned by sponsored during COVID, including ourselves at Ethnic Inclusion Foundation, to raise awareness of mental health. Neelam's story is a true story of a young girl with a breakup from her partner, which left her devastated, and is experiencing huge anxiety mental health issues during COVID. Through the medium of art and other clinical interventions, she was able to receive the crucial mental health support that was much needed. The lyrics include Man laga mora nahi, my mind is anxious and restless. So if we can actually have the video, please. It's so great to see that such an important message like mental health can be so creatively and beautifully executed, and importantly, Neelam's doing well through dance and music and other clinical interventions. So, I'm going to move on. I have the pleasure today of introducing our keynote speaker, Dr. Niraj Singh, consultant psychiatrist. I'm going to read your bio, Niraj. It's an amazing bio. Dr. Singh is the consultant psychiatrist and specialises in neurodevelopmental psychiatry. He has extensive experience in treating adults with ADHD, mental health illnesses associated with autism, intellectual disabilities, as well as other mental illnesses. Since 2009, Dr. Niraj Singh has worked as a community NHS consultant and also in private practice. He has, on top of that, an MBA and a postgraduate diploma in mental health law and personal coaching and mentoring, and has been involved in the setup of healthcare sector services. He's also the fellow and executive committee member of the Royal College of Psychiatrists, with both regional and national roles. In 2021, he took up post as an executive committee member of the Medical Cannabis Clinicians Society. Ladies and gentlemen, a big round of applause for Dr. Niraj Singh.
Wow, thank you so much, Santosh, for those kind words and that introduction, and absolute kudos to yourself, Dina, and everyone else who's been instrumental in this amazing setup. Absolutely beautiful. You know, I was just saying earlier to Santosh. Can you hear me first of all? Okay, right, okay. I was saying, Santosh, the energy and just vibe here is just incredible. You know, getting people here. So, obviously, hats off to you for such an amazing achievement. You know, and I think this is, as Santosh said, such a crucial issue, mental health. Yeah, but I'm a consultant psychiatrist, yeah, and psychiatrist means healer of the mind. But actually, you know, mind is not separate from body or spirit. Mind, body, spirit are actually one thing. So although medicine tells you that here's a doctor for the heart, here's a doctor for your sugar levels, here's a doctor for your lungs, actually, all these conditions that we talk about, be it Alzheimer's, diabetes, cancer, hypertension, depression, anxiety, post-traumatic stress, and so on and so forth, are absolutely connected. Yeah? And what's the commonality? What is the link? Inflammation. Yeah? Inflammation in the body. So when we talk about mental health and interventions, Santosh mentioned many of the barriers that South Asians have. Yeah? But one of the biggest things is actually the internal barriers that we have. The internal barriers that we take accountability and responsibility for our own health, and in order to drive that forward and improve ourselves. So can we have the first slide, please? Oh, second slide even.
Sorry.
That's all right, don't worry about it. I'm not sure if you can see those, but if it's not clear, we can share them later. But Santosh mentioned about the biopsychosocial model, yeah? And essentially that talks about, our well-being within our mind, biology within our kind of body, our neurochemistry, our DNA, and actually the fundamental kind of nature of our interactions with people and how we live day-to-day life as well. Thank you, Anna. So sorry for not being able to hear me. I'll move on. So what's absolutely crucial to know and understand is these things aren't mutually exclusive. Yeah, these are all interconnected, and that's the absolute thing. Yeah, your social circumstances. Yeah, for example, if you're isolated and you're living alone and you're depressed and you're lonely, you don't have those interactions with other people around you. That is conducive to increasing mental and physical health deterioration as well. Yeah, family life, relationships, life events, bereavements. These can all compound mental and physical health problems as well. Our biology, our inherent biology, we all have DNA. What happens in our environment actually makes changes in our DNA. Yeah? So whatever kind of way our DNA expresses itself is influenced by what we eat, how we live our life, how we interact with people, who's surrounding us, our sleep patterns, and whether we exercise, which I'm going to be talking to you about as well. And there's not one size fits all. The beauty of humanity is that we're all individual people, right? We're not one person. Yeah? We all have strengths. We all have weaknesses. Yeah? But we strive to work on those, and that's what's the most important thing. What works for one person may not work for one other person either. Yeah? And we have a health system which is absolutely vital. And I work in the NHS as well as a private sector, but I'm an absolute kind of in love with the NHS. for the amazing work that it does. Yeah? But it's also really important, like I said before, that individuals, everybody takes responsibility and accountability for your health. We're moving to this era of personalised medicine. But actually, personalised medicine should be about what people do on the inside, which reflects the outside, not just what happens on the outside, which influences them on the inside as well. Next slide, please. So just coming back to this, we have a confluence of different factors and overlap. Like I said, mind, body, spirit is one thing. Whatever happens to our mental health influences our physical health. And this is known, and this is evidence-based. If one is anxious, depressed, trauma, victim of trauma, any deterioration in their cognitive health, like memory problems, Alzheimer's, for example, that no doubt is going to have impact on their physical health as well. And increase the risk of diabetes, hypertension, cardiovascular problems, cancer even. These are all overlapping things. And I said the underlying kind of trajectory to that is actually inflammation as well. So we can all be limited by our physical health circumstances. For example, if we're at home and we're infirm, we can't necessarily have the ability to go out and interact with people. But there's always something that one can do despite a disability or an impairment or a handicap as well. And that's what's important to be aware of. All these factors influence each other. So how does it have a bearing on what we should do for ourselves day to day? Next step, please. Slide, please. How many people here exercise regularly? 1, 2, 3, 5, 6. Okay, 8. So late comers putting their hands up. I believe you. So 8 people in this room say they exercise regularly. Okay, that just goes to show. And I'll tell you why. Because we don't get taught about exercise in medical school. We don't get taught about nutrition in medical school. We don't get taught about good sleep hygiene in medical school. So when you go to your doctor or any clinician, how many of you have actually been spoken to about good nutritional health? How many people have actually been spoken to about exercise regimes and implementing exercise into your health? I could probably say single percentages in terms of figures. And that's the real thing. And this is where prevention is really important. And again, coming back to personal responsibility and accountability. Exercise is just one of those areas where it's so wide-ranging. There's lots of things you can do around aerobic exercise, resistance training, etc. When after the age of 30, your muscle mass starts to deteriorate between 6 and 8%. Every decade. So one of the best things you can do for your body is start to implement what's called resistance training. Now, this does not mean you need to go to the gym every day. Simple things such as resistance bands can actually help you keep your muscle tone. Going out for a brisk walk. Walking's one thing, but actually how are you raising your heart rate? All these exercises are really crucial for keeping that inflammation down. What you've got to think to yourself is, my body is full of these inflammation if I'm ill. I've got to think of ways in which I can cool it down, and what other ways I can do that. Exercise is one of those ways in which you can combat all this. Very, very important. And more research now is saying that if you want to live longer and live a more healthier life, because it's not just about lifespan, it's also about health span as well. Exercise is the best thing you can do for yourself. Even more than nutrition. However, we are what we eat as well, and nutrition is absolutely crucial. How many here would say they've got a healthy, nutritious diet? Okay. I'm not even putting my hand up, right? So it doesn't say much. But there's some really key components you need to have. We live in an era now where we have such an abundance of food supply. Everything's on tap. We can get whatever we want. But we're also living in an era where we have food which is full of simple carbohydrates, fats, trans fats, and processed foods. South Asian diet as well is blessed historically, because of Ayurveda. We have things like curcumin, haldi, kalonji, all the things that we get put in the food, which is absolutely amazing and medicinal for the body. Yeah. However, we've got other things like mithai. And who loves their mithai here? Yeah. Okay. But we have to be very measured. Now, this is not about removing the pleasures in life. Yeah. Because at the end of the day, we need to have those as well. That's important for well-being. It's good that we should be enjoying ourselves and making the most of it as well. However, everything has to be in balance. Yeah? And what's important is to know that you need to give your body a break sometimes. Yeah? This thing about 3 meals a day, I need to have breakfast, lunch and dinner, that's nonsense. Yeah? You don't need to keep filling your belly all the time. You might have heard about intermittent fasting. Yeah? What that does is it restricts the calories in your body, yeah. And if you do that, actually, in the medium term even, you're actually going to prolong your life. And where have we heard this from before? This is not new stuff. This has been in scriptures for thousands of years. This is not new. Yeah? So actually, giving your body a break, yeah, from food, yeah, have water is really, really important for both your physical and your mental health as well. Now, I'm not talking about necessarily people with severe illness, because at the end of the day, when you're severely ill, you're going to need that, level of support and input and that sort of thing. But you'll get to a point after which you need to be implementing these things as well. Omega-3, like I said, haldi, EGCG supplements as well, which you'll find in fruits and green tea, for example. And sleep, yeah? Sleep is so crucial. Good quality sleep. Sleep is about quantity, but it's about quality as well. Yeah? Getting a good nighttime routine. One of the biggest enemies of sleep are these things. Yeah? These devices. Yeah? We're hooked. Yeah? We can't get away from them. They're a blessing, but they're also a curse as well. Yeah? Because what they do is, the blue light that gets emitted from these will tell your brain to reduce the production of a hormone in the brain called melatonin, which tells your body to go to sleep. Yeah? So, before you get to sleep, shut off all your devices, at least by, it depends individual to individual. Some people might need 6 to 8 hours of sleep, some people may need less. The quintessential example is Maggie Thatcher, 4 hours a night was apparently she had, and very few people can live on that kind of amount of sleep. It does happen. Generally 6 to 8 hours is really important, a good quality sleep. So getting a good nighttime routine is really important. Making sure that you push away all the devices, that includes the TV, laptop, your phones, avoiding caffeinated drinks, getting exercise earlier on in the day, making sure the temperature in your room is fine, make sure that you've got adequate mattress and things. Blackout blinds, absolutely vital. Yeah? And again, if you sleep well, you feel better in your body, mind and spirit. Next slide, please. So, in recent years, doctors speak more about what's called social prescribing. And in my view, this should be actually an integral part of health. Yeah? It's not just about medicines. Yeah? Because medicines only just get rid of symptoms, right? Like I said, all this I'm talking about is taking responsibility and ownership of your own health. But there are other things that can be done outside the realm of tablets. Going out in nature, there's a beautiful video of a forest and trees and things that was on before. That's so important, is to go out into nature on a regular basis. Why? Well, plants produce oxygen for one, right? But they produce other molecules that you're going to be taking into your system. Yeah, things called terpenes, which are so vital, and these are anti-inflammatory. Yeah, they're there for a reason, right? So they're there because nature, and if you believe in the high spirits, which I do, has put them there because we bond together. We're not separate. Yeah, and they're actually really important for our health. But as Santosh mentioned, we're living in much more urbanization, concrete jungles, and that sort of thing. And so we need to take opportunity to go out and connect with nature on a much more regular basis. Other things, as I mentioned, making sure exercise and fitness is implemented in plans as well. Social connections. Yeah? Loneliness is an epidemic. And you can have people around you and still feel lonely. That's the thing as well. Yeah? There's isolation, but loneliness is a different thing. Loneliness is a feeling inside that I am not being supported or feeling completely abandoned. Yeah? And that can happen even if you have people around you. So making sure community services, amazing community services like this, these are things that help. You know, indirectly or directly, they're actually having a positive bearing on your physical, mental health, biologically, internally, in your DNA and everything as well. Providing support groups, community resources, volunteering. Imagine the kind of feeling that people get and joy out of volunteering. Yeah, it's mutually beneficial. You're not just serving the person next to you or with you, you're serving yourself as well in doing that and doing yourself. You know, it's medicine for you, it's medicine for your soul as well. Practical emotional support and referral to support services as well. So, social prescribing is absolutely important. I know somebody's going to be talking about that in a bit more detail. But if there's any take-home messages I'd like you to think about, is really think about your lifestyle. Yeah? Think about what you eat, you drink. Think about how your sleep patterns are. Think about exercise. Yeah, that's the crucial thing. Think about how you're going to embed exercise. It doesn't mean you need to build up to do marathons. Yeah, and always take guidance as well and do your research. Yeah, and make sure that you implement these things in your day-to-day life. It will pay dividends for your mental and your physical health. And as I said, these are not separate. Yeah, mental, physical health are one thing. Yeah. Okay, so I'll leave that there with yourselves. I'm around, so if anybody had any questions or wants to talk to me, had any queries, I'll be available.
Thank you. Thank you, Dr. Niraj Singh. That was absolutely food for thought. No pun there. I've taken out 4 key messages. The mind, body, spirit is connected. Nutrition and exercise is absolutely key. Responsibility and accountability for our health lies with ourselves. And the last one, and I'm not looking at anybody in the room, turn off that mobile at night. I'll say that again, turn off that mobile at night. So, I'd like to introduce our next speaker, Louise O'Riley, Leicestershire Partnership NHS Trust. Louise is the Communication and Engagement Manager for Mental Health, for the Mental Health Transformation Team, a lead partner in delivering the Better Mental Health for All strategy. She joined 2 years ago to help with the engagement on the public consultation, Step Up to Great Mental Health, and is now working on delivering the outcomes of this consultation with all partners. We're also working with Louise on the People Crisis Café and the whole Crisis Café strategy. So Louise, if I can actually ask you to step up to the podium, please.
It was really interesting to hear what Dr. Singh was saying about exercise. I used to work at Sport England, and they decided to get rid of the word sport and introduce something called physical activity. So when we talk about being well, the things that the body needs to do to be well is to be outdoors, with nature, with people, and it needs to be moving. And that's what the body needs to survive. So it's quite basic, isn't it, what we need to survive and thrive in life. So I've got some slides, but I'm not sure if they're going to move or not. So what I've come to talk to you about today is... What I've come to talk to you about today is what we're practically doing in Leicestershire and Rutland around the transformation of mental health. And I'm probably talking to quite a good crowd here because I think we're working with most people in this room at the moment, which is a great thing to see so many people here today. So we're doing something called No Wrong Door. If we move on to the next slide, which is obviously not for remembering, because it's really a bit of a work in progress, this. But what we're trying to do is so that anybody who needs mental health support There are more ways in to get that mental health support now. There is no wrong door. You won't be turned away, and it's easier access. So even in this room today, we've got the Crisis Cafes here represented, we've got Vita, and we've got P3, who are all there. So there are 3 new ways in to get support for your mental health. We've also got more mental health people working within our neighbourhood teams. So the practical ways of getting support for mental health have increased significantly. Just within Leicester and Rutland, within the last 3 years, we've introduced a 24/7 phone line now. So if anybody is struggling with their mental health, then they can call that number. And that is an easy way of getting support for anybody in a crisis. So what I wanted to talk about on this slide is the real work in neighbourhoods is beginning now, or it has been live for about the last year, but the real work should be finished by next March, next April. And when I say that, we mean putting a lot of the things in place around integrated neighbourhoods. So does everyone in here know that last July we became an integrated care system? Does anybody know what that is? So an integrated care system, what it means is that we're all supposed to be working together. So I'm from the NHS. We've got people in here from the local authority, from the county council or public health. And we've also got a great team of partners from the voluntary community sector, many of whom are here today. We're all supposed to be working together on this thing called mental health, and it's called Better Mental Health for All. So we're trying to make mental health not a medical model. It's not a medical model often until you get up to some of the stages where you do need support. But most of mental health is around staying well. And that's where we're trying to move this dial, is around staying well, getting earlier help, no wrong door, and getting that help where you live, in your neighbourhood. So we're putting more money, more resources, more practical stuff into neighbourhoods now for mental health. And we're working in a really integrated way. So we're talking to the council, we've set up a mental health network. We've got about 85 partners in our mental health network working with us in a positive way, trying to help lead the strategy and helping us to deliver this plan. So that's what we're doing on a strategic level. We're doing that now. And on a practical level, if you can see from that diagram, which is obviously you can't read it, but what we're doing is we're reconfiguring our local community mental health teams. We're putting more people into these teams, and we're putting more support into these teams. So when you come, say you do need some support from these teams, we're better equipped to get the support to you more quickly and to get you a solution and not to leave you waiting. So they're all the things that we're busy working on now. This work should be finished by end of next March. I say finished, I mean reconfigured, so the teams are all up and running and fully functioning. And those teams, we'll go on to the next slide. Those teams will then be working with our integrated neighbourhoods. And I've got a member of my team I'm going to introduce in a minute who is been employed to help develop these integrated neighbourhoods. So on this slide, I just wanted to reference some of the practical things that we are doing in health and working with our local authority and voluntary sector partners. And that's called Getting Help in Neighbourhoods. And on the Getting Help in Neighbourhoods, we funded 50 voluntary sector partners over the last year to about £2 million. So £2 million is going into projects, and some are here today who have started to develop these projects into supporting people with their mental health. And it is good to see that quite a few of these projects are around getting people out and physically active and connected with nature and with other people. So there's lots of work going on. Those 50 schemes are up and running. They're all on the website, and those schemes are part of our plan, our strategy of giving more support by the partners who know the support that's needed. So it's not the NHS giving the support, it's local partners. Just go on to the next slide. So this keeps slipping down. Yeah. So just to tell you about, we've rebranded something called the Crisis Cafes. So when we did the consultation to mental health and we did more support locally, one of the things that we said we would do is we would expand these things called Crisis Cafes. You'll see on the map now, obviously I'm glad you can't read it because we haven't announced them yet, but we've got 10 new Crisis Cafes coming live. And this means that we'll have 25 Crisis Cafes across the patch. What we're now rebranding them to, so sorry Santosh, we're rebranding now, so all her artwork's got to change, is that we're calling them the Neighbourhood Mental Health Cafes. And the tagline is to provide support when you're struggling to cope. So it's that local support. The reason why we rebranded them, we consulted with our voluntary sector partners, I know you weren't one of them, but we consulted with them and we asked them what they wanted them to be called, and there's a lot of people saying that crisis it put people off going into them, so we're rebranding at the moment. We've now got 25, we've got a lot in the city, so anybody is struggling or knows somebody struggling with their mental health, you can just walk into a crisis cafe. You don't have to have an appointment, it's nothing official. You can go in and talk to somebody, to a trained recovery worker, and get that support. And if that's all you need, that's all you need. If you need more help, then they can navigate you into getting more help. So that's a big development. That again that's more investment coming into local neighbourhoods. And then just to move on to the third area of investment, we've actually invested in people. So we now have 11 people who are employed as neighbourhood leads. And Aysha is here today. She might want to give a speech about herself. But Aysha's here today and she's been networking. I think she knows most people here. But we've got 11 Ayshas employed across LLR. And her role now is to go out and make those local community links. So you'll see we've got the Belgrave and Spinning network at the back of the room. So it's about helping to make those run. It's to set up more mental health networks across the city and to make sure that we are linking in all the people that can help to provide better mental health support. And that also includes GPs, it includes primary care, it includes the voluntary sector, it includes the local councils, the district councils, and the mental health services. So it's about all the people that can help provide better mental health support for all. Do you want to say anything, Aysha? You're going to say something at the end? Or you've done something?
Yes.
Oh. Okay, so that's what we said. I'm just going to finish off with a teaser. So we're having an event on the 21st of June, and we're inviting all the voluntary sector partners who are working with us in the mental health network, and we're launching a social prescribing service for all in Leicester and Rutland. And this is part of our integrated care system at work here. So we're working with the County Council, the City Council, Rutland County Council, the voluntary sector and health. And what we've heard from lots of partners is that people don't know what help is available. They don't know where to go. They don't know where to prescribe somebody to. And then they never see the outcome. So if you go and see your psychiatrist, you go and see your GP, and they back you off somewhere that they hope is going to help you, they don't often see the outcome of that. So what we're doing is we're launching a system now which can link into the patient record, but also it provides a front-end web platform that you can all use, that you can refer into. So Darren at P3 was saying that he's trying to build up his networks. Where does he navigate people to? What's out there for him? If he searches on loneliness in a certain area, what comes up for him? So he's having to make those that navigate without this tool. So this is something we're hoping to launch on the 21st of June. We'll be sending out invites for this, and then we'll be working with the voluntary sector then to make sure this system works, and with our colleagues like Aysha to go around and help with the networking on this. So that's just something that's going to come. We think it's going to help in terms of some of the lower level issues around mental health. And it's interesting when we start to look at this, because we now capture data on this, the things that are starting to come out of around social prescribing are things like long-term conditions, isolation and loneliness, mental health and physical activity. So it's everything that you talked about in your presentation just now. So they're the top things that social prescribers are sending people out to. So it's interesting, we can start to monitor that as we start together, and we can report back to our partners on how that's going. So that's what I wanted to say. So lots happening this year, lots happening building these integrated neighbourhoods, and lot of development around creating this no wrong door for people. So no matter where you live, you should know and be able to get easier and quicker support for your mental health. Thank you.
Thank you for that, Louise. Very comprehensive. And as Louise mentioned, the Crisis Cafes. So People Crisis Cafe, we run every Wednesday 2 to 8 p.m. The other Crisis Cafes run across the week. So if you want help Monday, Tuesday, Thursday, Friday, Saturday, even, I think, you'll have other help as well. We've got P3 who we've been partnering as well with, that Louise mentioned, and Turning Point as well, we've been working with as well. So fantastic work, I think, that the Leicestershire NHS are doing and for mental health. And I think we're looking forward to hearing more than Louise, as you mentioned. So I'm going to move on to our next speaker, Probably I don't need to introduce you, as I'm sure they all know you in the room, but I will do. I have great pleasure in introducing the Right Honourable Keith Vaz, who is the founder chairman of the think tank, the Integration Foundation, one of whose patrons is the Reverend Jesse Jackson. Keith hosts a weekly current affair radio programme, Talking Points, on Leica Radio, and he's also a keen campaigner on diabetes, having founded a national charity, Silver Star Diabetes, in 2007, some years ago, 2007. Notably, Keith is a type 2 diabetic, and some of you may have already visited the Silver Star van that's out in the Peepul car park. So with further ado, I introduce Keith Vaz. Well, not too far.
Not too far. They always say that about me, not too far. Look, I'm going to speak very briefly because you've had some absolutely brilliant speeches. I want to start, first of all, by just saying to Santosh and to her team here, what an amazing day. A People's Mela at the Peepul Centre. Isn't that amazing?
Yeah.
I think a big round of applause to the whole team, Sharan, Bijal, Nash, and the family that is the People's Centre. But in particular, I think I should come to the defence of the man I think you were looking at when you said he was always on his mobile, Anil Bhanot. Because without Anil, we would not be having the success that we have, building on what has happened. When he's on his mobile phone, he is talking to me, usually. And it's very, very important that he be allowed to continue to do that, so don't stop him.
As long as it's not after 12 o'clock.
Exactly.
When I first came to Leicester as an immigrant from London, 35 years ago, there was no People Centre. Rita Patel, of course, and the women of Belgrave Beheno began the process, and it's been taken to amazing levels by Santosh and Anil Bhanot. And I think that the fact that it's very much belonging to us, it's our centre, we feel very much a part of it, is because of the work that they do. But I'm here to talk very, very briefly about diabetes, because I think if we stay here much longer, if you weren't diabetic when you started, you will be at the end. Because we've had an amazing speech from Niraj Singh, Dr. Singh, and how incredible that he managed to get his dad to come, sit in the front row, and film him. Now, I say this because my passion for diabetes started, sadly, with my mum, who contracted diabetes, type 2, and then she got type 1 because she didn't manage it. And she eventually died at a very, very young age. She was only 73 when she died. And I feel guilty and responsible because at that time I was in Parliament, I was a minister, and to be frank, I was more interested in doing my job as a minister than looking after my mum. And as a result of that, I didn't take care of my mum as I should have done. I didn't find out about diabetes, and she was one of the 24,000 people a year who die early because of diabetes complications. I would give anything to have my mum sitting in the front row and filming me, though she would have been 93 had she lived this long. And that is why I became a campaigner for diabetes, first in Parliament and then since I left. And I think it's really important in the South Asian community that we understand that diabetes is a killer. Don't just do what people do, take their metformins and hope for the best. Because this will mean you will get to an early death. I promise you it will happen. And I, with my passion for chocolate, for milk chocolate, my passion for not doing any exercise, okay, everything that Dr. Singh said we should do, I do not do, has meant that I think that even I, with all these years of experience in diabetes, don't understand how our lives have got to change. Lifestyle changes are really, really important. Our NHS is totally ill-equipped to deal with diabetes. And that is because, for a start, it's so difficult to get to see your GP. And when you do get to see your GP, you don't have enough time to talk to your GP. Therefore, we have to be responsible for our health. The stuff that goes on here is more relevant to people than going and waiting in a GP surgery because they just don't have the time. I welcome what the Prime Minister did last week in giving more responsibilities to pharmacists, letting them get more involved, simply because my mum, before she died, had every faith in Ketton, her pharmacist in Evington, near the Waitrose in Evington, and she used to go to him for advice. We need to make sure that other people are involved in our health service and delivering, rather than just our GPs. There's not an attack on GPs, they do a terrific job, but they just don't have enough time. And even someone like Dr. Singh, to get to see Dr. Singh on the NHS will probably take you 2 years, because the waiting list is so long. And we can reorganise the health service hundreds of times. And poor old Louise, she's probably sat through a dozen reorganisations by governments. They change this, they change that, they integrate her, they de-integrate her. And while all that is happening, people are actually dying. And I think we need to take responsibility for our health. We need to make sure we do the kinds of things that Dr. Singh said. And the first thing I want you to do is just stand up. Just stand up now, everyone, just for a second, okay? Just for 1 second, everyone stand up, because that makes a big difference if you stand rather than you sit, those of you obviously who can stand, for 8 hours. If you're sitting down all the time, you do not get the kind of health benefits of standing and walking. Thank you, you can sit down. But just moving, which is what Louise and Nij said, is really, really important. And that's why when I try to give speeches these days, I try to move around, I try to walk, because that makes a huge difference. 5 things I've done that I think have changed my life. The first thing, with the greatest of respect to what you said to Anil, I am a big TikTok fan. And every day when I get up, I spend an hour on TikTok, and I spend an hour on TikTok when I go to sleep. Sorry about that, Santosh. And the information that actually comes out about diabetes is incredible. Kerala juice, I'm now buying this on a regular basis. I'm having this with every single meal. There are other products that people talk about, most of them natural, the kinds of things that Dr. Singh talked about, natural products, which actually are better than constantly having medication. You have to have your medication, but you can supplement it with other things. The second thing I've done is I do not eat my evening meal after 8 o'clock. That is too late. We go out to dinner and we have our meals far too late, especially in the South Asian community. Thirdly, I try to stop eating sugar. Obviously, on the way up today, I did stop at the welcome break. I did have a tiny bit, a bite-size caramel shortbread, which I shouldn't have done. It has made a difference, but I can't give everything up. At the end of her life, my mum said, I really can't stop the things I really want to do. What's the point of living? So we have to doctor, your dad is talking about mangoes, and he knows I'm a real big fan of mangoes, but I haven't had a single mango in the season. I'm having some coconut juice from downstairs. The other thing that I've done is a type 2 diabetic. I'm not entitled to this, by the way, but I've gone and bought it because actually I can afford to do it, most people can't. And you'll hold that for a second. This is what I've got. I've got myself one of these, okay, which is the Abbott Freestyle Libre, which means that I can test my blood sugar, okay, by just pressing this on here, and I get a reading. I'm currently a 7. I was a 10 when I started, and I sat down there. And actually I'm a 7 now, because I've got fed up of pricking my fingers every single day, remembering whether I've eaten or not. You're not entitled to this as a type 2 diabetic. costs me 40 quid, it's far too much. But I do it because I don't want a finger prick. If you're a type 1 diabetic in this room, or if you know a type 1 diabetic, you are entitled to this free on the NHS. Go to your GP and ask. Your GP also has the power, if he or she wants, to prescribe one of these if you feel that you don't want to use finger pricking. It's made a huge difference to my life, okay? It doesn't tell me what to eat and what not to eat, but it keeps me within the box. It also tells me an HB1AC figure just by scanning. It's expensive. Don't get it if you can't afford it. Go and see your GP and ask if he's prepared to do it. And the last thing I suppose I've done is I've got the little app on my phone which will tell me how many steps I've done. Now, some people think this is a bit of a joke, but I actually take this really seriously. When I get to 9,900 and it's nearly midnight, I tend to walk around the table. My cockapoo dog thinks there's something wrong with me and starts following me around, but I need to get to that 10,000. I will not be doing 10,000 today because I've been sat here for an hour, but I'm off to Rushy Fields to see a cricket group, and I think I might be able to walk around a little bit more. Everything that he has said, I mean, you know, he's really a psychiatrist, not a GP specialising in diabetes, of which there are many, such as mine, Dr. Faruqi, who's an incredible GP on diabetes. But he's given us some really, really good information, which we all need to take on board. If we don't, you can knock 5 years off your life, okay? I'm not even a grandfather, I'm trying to get my kids married. Anyone here who's single, let me know. Because I'm in the last 10 years of my life, I think. You know, the last quarter, all right, the last quarter. I'd love to live as long as Queen Elizabeth II. But I think she ate much better than I did. I do. But the fact is, diet, exercise, lifestyle, these are the essential guides if you want to stop, you want to reduce your level of diabetes, your blood sugar levels. 2 final things that I'm going to stop. First of all, outside is the diabetes bus. We've got 4 of them, 2 in India, 2 in the UK. Please go and have yourself tested. Please try not to eat before you get it tested. And secondly, at the Merlin Vaz Centre, you have this incredible project that is a partnership between Silver Star and Imperial College. You can have a complete MOT, which is worth 3,000 quid in the private sector, absolutely free until the 31st of December, and they will give you a long report about what's going on. Imperial College, led by Professor Kuna, is trying to test 100,000 people from the South Asian community in order to gather data as to why we are more susceptible to diabetes, cardiovascular disease, mental health and all these other issues. Please, the NHS has provided some good services for you. This organisation has done incredible work. I'm so proud of it. Make sure we use it. Thank you very much.
In this last 20 minutes, we are going to have a roving mic, and I'm going to hand over to Sharon because she's going to do this a lot better than I can do. She's got the might and the right.
Oh, I'm snatching it from her. Right, sorry. Okay, I'm going to rename it, and I said this to Dina yesterday. We're going to do it as speed dating. Okay, don't all sound so excited. Maybe I will. Thank you. We're not really going to go on a date. Unless you really want to take me for coffee, then yeah, I'm all for it. No, we thought it would be fun, but you've got a time limit. Being a teacher, we stick to time limits. So, I'm going to give all the stall holders 1 minute to have in their head what they're going to share. And I'm going to whiz round as fast as I can with a remote, not a remote, a mic. Oh, 2 mics, just, you know. And we are going to share, because I don't know about yourself, but it's been a busy day. You might not have got round all the different stalls. You might be sitting there, and I don't know about yourself, but while listening to all the speeches, I was nodding away. There was little bits I connected to. You might not know who to go see help for or who to go and get advice from. So having a bit of an intro from everyone will give you a bit of an insight. And if you feel that you couldn't approach anyone in front of everyone today, please contact Dina, Santosh or myself or anybody in the Peepul Crisis Café or any of the different vendors if you do need help with regards to mental health issues. We're all in it together. So, you've had your minute. Are you ready? Everyone looks so scared. I love it. Power. And then if we can have some lights on. The power of the mic. So, we have P3. You've got 60 seconds. Go.
Right, so we are the mental health recovery service, and we help people to get out and become independent individuals again, help them with getting back to community, mental health intervention. We also do have some peer support groups like they can join and have a nice open space to share their issues or how they deal with their mental health with. Just the last 10 seconds, we do a lot of things going on next week for the Mental Health Awareness Week, so feel free to come over and grab the leaflet with all the information in. Thank you.
Wow, did it in 30 seconds! Wow, and if you really weren't taken, got a nice little pink fluffy thing. I've got Dean on the clock, are you ready? Beats, right, I'm going to leave it to the professionals. Right, we're ready, go!
I'm really sorry about this. Okay, not prepared, but 1 minute. So we are Vita Health Group. Originally we were known as Vitamins, stroke IAP services, but now we are known as talking therapies, so that will be our new name. What we do is we work with people who has got low to moderate anxiety or depression of any level, then we are here to help. We work with people who are 16 plus, and the service is free. So we have lots of information here, something here with QR code. You can go onto the website. I've been given 10 seconds now. Come and see us. Anything to do with anxiety, depression, come and see us, please. Sheila Solanki, thank you.
Can we give her a round of applause? Also, lollipop, on the table, you know, right, go on.
Hi, I'm Maya, one of the recovery workers. We run a crisis cafe on a Wednesday 2 till 8. It's not an appointment based thing. We then signpost you to different people that is out there, what we have contacts with. You can just talk if you want to talk, and we're a good listener. I think that's about it I can say.
Whoa.
Oh, hold on a second.
Maya, she's just been to the she's just traveling.
Okay, so on Saturday I was invited to the King's coronation at Westminster Abbey. So I was there in person. It was an experience, and I'm glad I'm a part of life. I'm part of history of the making of seeing a king. Yeah, and I made it in the Daily Mirror as well, with a photograph with Emma Thompson. So
up in a bit just to keep it a bit, you know, lively.
Yeah, please do.
Hello, good afternoon everybody. My name is Dr. Niraj Singh. I'm one of the consultant psychiatrists in the LPT in the perinatal mental services. And perinatal mental services is a very specialized mental services which help people who suffer with moderate to severe mental illness during pregnancy and up to 1 year of the age of the child. A lot of people might not be aware, but these services have been, with the LPT list, covering Leicestershire and Rutland for some time. So please, speak to your midwife and GP if you have any issues with the mental health during pregnancy and following childbirth. Thank you.
Lipstick on! You can tell she's Punjabi, can't you?
I'm stuck for words.
Well, she's definitely not Punjabi then.
Start the timer from the beginning. My name's Indy. I'm the founder of Up and Up and Cancer Support. It's a very new project. It's a welcoming space for those living with and beyond cancer, their carers, family, friends, and also the bereaved. We offer a space in 3 locations in Leicester. We're in the West Coast, Belgrave and Evington area. We meet up, there's a jalaka, masala jalaka, a bit of chutney frying around as well, but also not taking away the seriousness of the topic. If people wish to talk and share anything, that's their opportunity to do so. We work through some cultural taboos and other things that people want to bring to the table. But for me, it's about talking helps and listening heals. And also some wellbeing activities for physical and mental wellbeing, and I'll stop there.
Wow, can we give her a round of applause? And, okay, we're moving on. I'm really sorry, I'm blocking you guys. Oh, they're going to mess with it. Oh,
I got you.
my bodyguards. Right, over to you.
Hi, my name is Sharan Shahid and I work for Health West Leicester, Leicestershire. So basically we are independent, we're local champion. We also have the overall power actually working with service product. What we do, I'm a community outreach officer for all over Leicester, Leicestershire, and I work with, engage with communities, capturing their voices about health and social care services, anything they would like to see improvement in health and social care services, and services that's going well. So we capture all their voices and share with the service providers and commissioners and work with them to improve the service for the public in Leicester, Leicestershire.
Thank you, round of applause. Now we're going to go through. We've got our eyes on you. Get it? No? Okay. I think there are taxis here.
My name's Imran, this is Afsal. We're part of the diabetic eye screening service. Not eye screening. And basically we see patients who are 12 years and over, and we're looking for signs of retinopathy. So we're looking at the retina at the back of the eye, and we're looking to see if there's any kind of bleeds, hemorrhages or exudates, things that can affect the eyesight and potentially lose vision. Thank you.
Thank you. Right, first hold a lot of pressure. Talking.
Thank you.
You're welcome. I like your glasses, by the way.
You didn't mention my hair as well. I spent hours on my hair.
Do you know what? One compliment a day, yeah?
Good afternoon, everybody. My name's Paul Houseman. I'm the manager for the Belgrade and Spinney Hill PCN Primary Care Network. That's a group of GP surgeries. Spinney Hill Medical Centre, Eastport Medical Centre, the Charnwood Practice, Cannon Street and Broadhurst Street. So 5 practices, 7 locations, 46,000 patients. It's fully funded by the NHS. And we're here to promote our links and working with all the wonderful charities and organisations today. And also working with Aysha and Louise and Santosh on trying to figure out just how we make the pathways better for all service users, however they access any mental health. The team I've got here today, the 3 bodyguards in the corner, they're clinical, they're the physician's associates, they're working in the week and in evenings and in weekends on Saturdays.
Oh, 60 seconds.
We have our
just saying NHS.
Social prescriber. So we talked a lot about social prescribers. Nahida is our PCN social prescriber. We have our mental health support workers, Narinda and Christine, here today as well. And we have a specialty doctor, Dr. Wake, who was in clinic this morning at Merlin Bowers doing a women's health clinic, including menopause. So lots of different services, and great to be here and see everybody today. Thank you.
Not going to point out. And who's going to take the mic? Where we go, off you go.
Hi everybody, I'm Sana, this is Sean, we're from Westport Community Centre. A little bit about us, we do a lot, however I'll just narrow it down. So just to start off with, we have our very own preschool, we have a day centre, we have youth clubs that are running, we have ESOL classes, theory classes, lots and lots of classes that are happening within our community centre. We do also have a celebration actually on Saturday, 20th May. Come along, it's a community event. It's to celebrate 40 plus years of our very own preschool. Thank you so much.
Wow. Whoa. Sorry.
I know we tucked away in the corner.
Do you know what? How can I miss the beautiful ladies in the saris? Right, over you go.
Thank you. Thanks very much. I'm Tony Mystery. I'm the CEO of Leicester Community Links. This is who we are. I've got some volunteers around me. They're all scattered everywhere. But afternoon to everybody. We are an award-winning wellbeing and mental health service. We've recently been awarded Platinum Jubilee Award and also more recently a Coronation Champion, which is just a man over here. So we were in the concert in Windsor. Thank you. We're all about supporting mental health and physical health. So a lot of the presentations resonated with us. We encourage physical activity, which is important because if you're physically physically active and physically fit, it really helps your mental health and you feel better. So we have regular walking groups, we have a gardening group, we have Tai Chi, we have yoga sessions, we have regular workshops on mental health. We invite health practitioners to come and do talks as well. We're a small organisation, but just last piece of news I'd like to share with you. Recently, through the National Lottery, the People's Projects, we're one of the 5 finalists regionally. So we're going to be on ITV News next Wednesday. This Wednesday evening, please watch, we're on TV. There's a film about us and please vote for us. The voting starts tomorrow. National Lottery, People's Project. Thank you.
Sorry, like every woman in the world, they want to get first. We've got some people out on the corridor, so I would like them to come over here. If there's anyone else in the corridor that wants to share 60 seconds, none of them are listening to me. It's been like back in class. Come forward. We've got 2 people that are outside. Off you go, 6 seconds.
Thank you. My name's Bav. I've set up a non-profit CIC. It's an early intervention social emotional education. I think it's really important to work with teenagers to help them understand their feelings, help them understand what their basic needs are. So I'm really driving towards educating parents and families. That's it. Thank you very much.
Thank you. Hi, I'm Kiran Mistry, Chair and Founder of South Asian Health Action. We're a charity focusing around from a patient, carer, community-led voice. But to keep the time short, we're outside. We've got a special screening for Mental Health Awareness Week. We had one yesterday, but we've got one on Sunday, next Sunday, Sandeep Story. It's in the Gurdwara on Teach Park Road, 11 till 2. So please come along. We have to raise awareness about mental health, and it's still a stigma that we've got to tackle. Thank you.
Totally agree. Now, this guy like put his jacket on, he sorted his hair out, he beat you, he beat you, something, he beat you, put his jacket on, put a bit of aftershave on, just saying. Over to you.
I was already nervous, but now I'm not.
I have that effect.
Hi everyone, my name's Osama. I feel sorry for the guys in the middle. They all have to do a 180 turn just to get me, but sorry. But I work for Zyla Health and Wellbeing. Part of the NHS Diabetes Prevention Programme. There's lovely chaps in the front that will talk about diabetes, Keith Vaz and Dr. over there, all about nutrition. So we have our nutritionist right here. She'll be doing a workshop later on. So if you come to the workshop, I think it's in room 4. So it's all about diabetes prevention. Prevention is better than the cure. So it's all about creating awareness that there is support out there for you. That if you do want to find out more about diabetes and how to prevent diabetes, come to our store and we can help you.
Thank you. And just to remind you, the workshops at 3:30 in room 4. It is really good to go to. We don't always have the time to find out information. So now while you're here, let's enjoy it. Right, ladies, which one's going for it? Oh, you look so happy. It's fun. You know the magical powers you have from holding the mic. Everyone has to listen.
So my name is Roz and I'm here with Helen and Attica, and we have come from, we're based at the Glenfield, but we are the Leicester, Leicestershire and Rutland TB nursing service. So we are responsible for providing a targeted BCG programme to Leicester. We're also responsible for the latent TB, providing care for latent TB infection. So that's TB that's not making people ill, but it's lying dormant or inactive, and it's a preventative strike that we try and provide. And we're also responsible for providing care for patients with active TB as well. So a lot of, it's been absolutely fantastic being here today, seeing the overlap between all the services. And seeing how important it is in terms of mental health and general well-being, how that fits in with us and our care for TB patients. We're all about raising awareness to support early diagnosis of TB and signposting to other services so that we can overlap with the other services as well as the service that we provide. So thank you, it has been amazing being here. We feel very inspired, so it's great.
Ladies, and I'm sure this will be a yearly event, so we'll look forward to seeing you guys next year. And obviously, as we grow, as do the people now, we've got to hurry up, ladies. I hope someone's got a date at the after the speed dating. Are you ready?
Hello, my name's Fatima Zareen. I'm a volunteer at Shama Women's Centre. We offer a wide variety of programs to empower women. We've got a lot of creative workshops like baking, cooking, arts and crafts, hair and makeup. We also run a job club every Tuesday. We have a chai and chat session every Monday, and being Mental Health Awareness Week. This week we're going to be concentrating on mental health and anxiety, so do come along for a chat and a cup of tea. Like I said, we offer a lot of programs. At the moment we're concentrating on the Core 20 Plus, which is raising awareness with about hypertension, cancer, Dennemery disease, can't even say that, and cardiology we're also concentrating on. So we're just giving out information how important it is for people to have their checkups, and we've got lots of leaflets and things, so please feel free to come to the store and take some. It gives information about what to look out for and everything. We've also got lots of sweets and things, so come and say hi to us.
Hey, that's what we want to see. We've got two ladies, one lady, two from outside as well. Do you want to come in through now? Can I just say, all stands have lots of leaflets. If you didn't quite catch everything, please go visit those tables. There's lots of literature. I've noticed there's business cards available in different languages, so if you know back home you don't speak English or they need a different language, I think all of them cater for them, so please visit the tables.
Oh, brilliant. Hello, my name is Emerald. I'm from the National AAA Screening Program, and basically it is for the men at the age of 65. So if you know anyone who is over the age of 65, never had an ultrasound scan, you can always come over to me and we can book a scan for them, and I'm looking at scanning them today in case if anyone didn't have a scan. So basically what it involves is, I'll be doing an ultrasound scan to look at the main blood vessel in your tummy, which comes from the heart, comes to your abdomen, then goes down to supply legs. So it is an asymptomatic condition, it doesn't give you any symptoms, and when it decides to rupture, unfortunately it goes fatal. So it's best to get this checked. So if anyone over the age of 65 never had a scan, I just give me a shout, we can arrange the appointment for you. Thank you.
Right guys, I know there's no one over 65, you're all 21, but if you did want to get checked, please go, it is important, you just don't know.
Hi, my name is Sharon and I'm here with my colleague Gauri. We're here from the Bowel Cancer Screening Program. As everybody knows, 1 in 2 people will have a cancer. Bowel cancer is the 4th most common cancer, but it's the 2nd highest mortality rate. However, Leicestershire has the lowest 1-year survival rate in England. So we are here, especially to the South Asian community, to push you to do your screening. It's free, it comes to your home, and it's easy to do. It's even easier now with just the one pot. So we're really pushing you to tell your mums, aunts, uncles, anybody above the age. At the moment it's the age of 56 to 74, and from end of next year it should go down to 50. So please encourage anybody within that age to do the screening. As people said earlier, prevention is better than cure. Thank you.
Hi, my name is Kamala Patney. Just some things that Louise mentioned. I am the voluntary sector representative on the LLR, and my role is to gather information from all of these organisations, the VCS sector, and actually channel them into the top level meetings of the Mental Health Collaborative. And I would like to be able to have an opportunity to field what you want me to raise. Without that, you know, our voice is just numb. So I just wanted to say that. Thank you.
I'm here from Leicester Life Links. So we're a mental health, wellbeing and recovery support service. We are part of Richmond Fellowship, which is a national organisation, and essentially we support people who are over 18 who either have a mental health diagnosis or are more generally experiencing elements of poor mental health. So we are county based, so we actually support people who live in Blaby, Oadby, Wigston and the Harbour district as well. We provide support in many different ways, so we provide general information, advice, navigation, signposting. We have a one-to-one service, we do group mental health courses, we provide peer support groups and recovery education workshops as well. We're a completely free service, and we also do have volunteering opportunities as well. So we encourage those with lived experience or anybody who has an interest in mental health to get involved. Thank you.
Last but no way by least. I got the eye rolling. I am definitely back in class here. You're preparing me for tomorrow, aren't you? Are you you've had like 20 minutes to prepare, lady. Come on.
I am.
You are, because she's on it. It's going to knock me out in a minute as well.
Hi everybody, I'm Sneha. I currently work for Turning Point. Turning Point is a national charity up and down the country. We see people with drug and alcohol problems, but one of the areas that we work with is learning disabilities and mental health. And we have a few of them, homes, supported housing in Nottingham and places up and down the country. Now, my role is predominantly as an advanced practitioner with mental health and substance use. We work very, very closely with LPT over at Bradgate Uni. We hold the largest contract here for LLR and Turning Point. Turning Point is everywhere, in the hospitals, police stations, young people's team, you name it, we're everywhere. So today I think I've just taken a lot away from all the speakers and all the event holders here, because it's been a great network opportunity, but also I think I'd just like to say what Dr. Singh was saying about his mental health and well-being, things around, mindfulness and everything. And that's something we're really big on, running mindfulness groups, and I also run a crisis survival group with one of our psychologists. We also have consultant psychologists based within our services and in young people's services. So thank you all today. I've learned a lot from you guys, and I hope to network with you all. Thank you.
Thank you. Bless her, she was rolling, but she was on it. Well done. Right, I'm going to pass you back to Santosh. Are you ready? I'm going to part with the mic.
Yes, so didn't Sharon do well? Let's give her
Still didn't get a date though after all that.
Well, you don't know. These things happen behind closed curtains.
Oh, wow.
There you go. So just to conclude today, I'd like to thank our speakers, Dr. Niraj Singh, Aysha Jagat, Louise O'Riley, and Keith Vaz. I'd also like to give a big thank you to my steering team who's helped to put this together today. So we have Dina, Sharon, Amrit, Maya, Piki, Jit and Raj, who are also part of the People Crisis Café. They worked really hard, and I think that it has actually exceeded our expectations. And like I say, it's the first time that we've run this from our side, and we're so happy and delighted how things have turned out. I'd also like to give a big thank you, a really, really big thank you to you guys, the NHS, our community people, our independent health partners, who've made today happen as well. And the stalls and what you've brought on and how you've interacted with the service users has been very, very good. So please give yourselves a big round of applause. So I'm just going to close, and I was looking through my notes as I was preparing for today, and I came across the WHO definition of mental health. And I think this is something that we should actually try and strive for. And you heard Dr. Niraj Singh, you heard what Louise was talking about, you heard what Keith Vaz was talking about. So the definition is, mental health is defined as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to contribute to his or her community. And I think that's really the goal that we want to move forward for here. So thank you all for coming today. We have a workshop starting downstairs at around 3:30. I don't know if someone is Kushbu here or?
Yeah, she's downstairs.
She's downstairs. So if you tell her to hold, which will give time for people to actually get down to there.
What's the workshop?
So the workshop is actually on nutrition. You heard how Dr. Niraj Singh talked about the importance of nutrition for both diabetes, cardio and other health. And this is a talk around nutrition, but it's tailored to the South Asian diet. So what it is that we are eating today, the samosas, the mithai, all that sugar-loaded stuff, all the carbs, the rotis, the naans, how to actually be better in terms of getting off that, and what are good substitutes and so on. So I think it's a really worthwhile workshop to go to, and it's here and now and free. So it's going to be about 20 minutes and Q&A. It's a really, really worthwhile thing to go to. Usama, do you want to build on that?
Yeah, can you just find the person where the room is?
So it's room 4, which is 1 floor down, and you have to walk
through the glass door,
past the restaurant, and to the left.
Yeah, so if right now you were to go, you go down the stairs and you would immediately take a left. So you pass the restaurant on your left, you go through the glass doors, and it's literally we signpost room 4, and it's the 4th room down.
Thank you.
Sorry.
I was just going to say, so we're basically going to wrap up around 4 o'clock today, which will be at the end of the workshop. So again, thank you for being here.
Can I just say, can we do a massive round of applause for Santosh as well for today? A lot of hard work from myself, so thank you.
Oh, really? Amazing. That's really good.